You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today is joining me from Australia. He is Dr. Tom Tutton, National Manager, Aspect Practice and Clinical Lead Positive Behaviour Support, Autism Spectrum, and joins us today to talk about the autism spectrum and his work in Australia. Dr. Tutton, welcome to Health Professional Radio.
Thanks so much for having me.
Now, Tom, I wonder if you can tell us what it is that Autism Spectrum Australia do and whereabouts you do it, what geographical footprint you occupy.
Sure. We're a national organisation in Australia. We were born 50 years ago this year in Sydney in New South Wales. Originally, a group of small dedicated parents set up an autism-specific school. I think they were not happy with the educational provision that was happening at the time. And from that small school, a very big organisation has grown. We support over 10,000 people with autism and their families each year, and we provide services from early intervention and diagnosis right through to social, leisure, community and workplace supports for adults and pretty much everything in between. We have the largest independent autism-specific school system in the world, as far as I'm aware, which includes a number of schools across New South Wales and a new school opening up in South Australia too. And we have a really interesting schools program that's very much focused on integration. So young students with autism come to the schools, they learn good school skills, plus on top of the curriculum learn skills like social skills, communication skills, emotional regulation skills, and then gradually move into mainstream through what we call a satellite program as well. So we're a big organisation, and we do a lot of different types of support for people on the autism spectrum and their families.
Now, Tom, our audience is largely clinical, but in fairness to clinicians of all colours, I have to say that often there is a degree of social isolation or professional isolation in some clinicians in that they are focused on their particular specialty or their particular ward or patient group in a hospital. And so I'm sure they all studied autism when they were doing their prospective studies. What message would you like them to know today as a result of having heard you on the radio?
It's a really good question. I think, again, within Aspect, we have a range of different therapists working for us. So we have psychologists, we have speech pathologists, we have occupational therapists, as well as obviously teachers and a range of other different staff. I think the key message is always to look at the individual holistically. I think often you might get called in to do a little bit of perhaps speech pathology. That might be something that supports somebody's communication skills. The important thing, I think, is that is done in coordination with all of the other work that's happening around with the individual, not in isolation. And I think in my work, I do see sometimes people jumping in and say, right, let's do this and getting on with a piece of work, but actually not actually making sure that is in line with the broader goals for that person.
I do notice on the website it says autism lasts a lifetime and affects 1 in 100 Australians. That was an extraordinarily high figure for me to read. Do you think the clinical community is generally aware of how prevalent it is?
Look, I think increasingly so. I think it's one of those things because of the controversies about the numbers that have happened perhaps over the last 5 years or so, and the issues around why that might have been. Obviously, most people will be aware of the vaccination controversies and other potential causatory factors that people have suggested. I think that has pushed the numbers very much into people's consciousness. Hopefully, people are also aware that probably the reason behind this very high figure is a combination of massively increased awareness of autism. So years ago, many people would have been perhaps just received a diagnosis of some sort of intellectual disability, and there has been that diagnostic substitution. But also the criteria for autism in terms of capturing people on the spectrum has broadened and broadened up till the Diagnostic and Statistical Manual, which was only released, I think it was last year. So, the net is wider and it's capturing more people, and hopefully that represents a good explanation of much of what's happened, if not all of it.
Yes, it's one of those diagnoses, I think, that must cause a lot of concern for parents because it is such a broad spectrum and it does have such a wide range of behaviours associated with it.
Yes, that's right. I think one of those big questions is what does it mean and what are the outcomes? And I think you will hear people today tell stories of years ago when children were diagnosed that they were pretty much told to give up hope. And, that's a terrible message, and I think a really false one as well. I think whatever the capacity of the person, there is always something that they can achieve on their own personal level. And I think families can and do get something from that once, I guess, the period of changing their expectations around what having a child and child development would have been their expectation.
Tom, one of my favourite questions in every interview is about misconceptions, and I guess in every line of work and in every endeavour there are misconceptions. Is there a misconception amongst your clients, patients, colleagues that drives you mad and keeps you awake at night?
Yes. I mean, there are lots. I think one of the things when you work in the autism field is you start to make a list of all of the sort of myths and misbeliefs around autism. You'll find them on the internet, sort of top 10 sort of myths about autism. For me personally, though, my speciality within my work is very much around positive behaviour support. So I work in situations where there's some sort of challenging behaviour to help people on the spectrum, families, other service providers, sort of make sense of that and develop a good positive outcomes. And I think the biggest misnomer in that situation is that the problem resides within the individual. So that person, it's his fault, it's his behaviour, he has to change or he has to have some medication. But actually, there's really good evidence that the model of understanding behaviour relates, yes, partly to the person, but also very much to the environment that they spend their time in and those people and the interactions with those environments. So my job is always about trying to address each one of those three areas rather than just trying to fix the individual. And again, we get a lot of referrals for psychologists to say, can you come and fix this person who has challenging behaviour? And it takes some education, I think, from our point of view to say, well, we can work with them, but really there's more than the person we have to change here.
I can understand why misconceptions would be a thing that you notice in your work. I do appreciate your time today, Tom. It's been a pleasure having you with us on Health Professional Radio.
Fantastic. Thanks for having me.
I've been in conversation with Dr. Tom Tutton, and we've been having an interesting chat about his work as National Manager, Aspects Practice and Clinical Lead Positive Behaviour Support in the Autism Spectrum with Autism Spectrum Australia. Now, if you want to get in touch with Dr. Tutton, the best place to go to find him is on their website at www.autismspectrum.org.au. Or if you'd like to hear the interview again or read the transcript, we have both of those available on our website at Health Professional Radio. You can find a transcript of the full interview, and you can also find the audio archive, which is on YouTube and SoundCloud, and there are links to all of those resources at www.healthprofessionalradio.com.au. My name is Wayne Bucklar. You've been listening to Health Professional Radio.